I'm your host, Jennifer Pulapaka with Podiatry Doc Talk. Regain your health with quick and ingenious tips and chats so you can be stronger and healthier. I'm here making complex foot and ankle problems sensible and simple. Episode 3, Diabetic Foot Care, the Do's and the Don'ts. Diabetic patients can keep their feet for a lifetime, but it does require some education and some daily routines in order to get you through the tough times. Diabetic patients are very susceptible to a problem known as peripheral neuropathy. Once peripheral neuropathy has set in, patients start to lose sensation in their feet. This can be particularly devastating if you also start to include peripheral vascular disease. So a routine is good for patients to start on. A daily routine is what patients need to follow. And that requires diligence. The first thing that patients need to do is to check their feet daily. I recommend to my patients, if they can't look at the bottom of their feet, have a friend or a family member inspect their feet. Also, stop using black or brown socks. Use white or cream. It makes finding wounds a little bit more easy. You can find an area that may have drainage or a little bit of blood, and that's when you need to call your podiatrist and get in. After you're done with your inspection, remember these 5 keys to follow. Instead of using soap, change to lotion. A very affordable lotion can be used when you don't see dirt on the skin and it's the end of the day and you want to wash your legs. Move to a lotion. That will prevent some of the natural oils from being removed. As a diabetic, you also have a decreased production in sweat and oil on the surface of the skin. Take care of your corns and calluses. Corns and calluses are thickened areas of skin that result from pressure in an area. Poorly fitting shoes are the main cause for calluses on our feet. These areas are actually a buildup of skin that's used in the form of protection. They're trying to decrease the amount of soft skin that comes in contact with the shoe to prevent a wound from coming on. Sometimes diabetic patients can even have an area of thickened skin over an existing wound or ulcer. This results usually in a deep abscess and an infection in the foot, which leads us to wound care. A drugstore is a good place to pick up a few items such as band-aids, shampoo, lotions, but it doesn't take the place of good diabetic foot care by a wound care physician. And when is it time to come in and see your podiatrist? When a wound takes longer than 48 hours to show signs of improvement, it's time to call your podiatrist. And even if you think the wound is improving, but you're starting to see signs of an infection, such as redness, swelling, drainage, or pain, come into the office, be seen. Make sure everything's okay with that foot. A way to help prevent this breakdown in skin is to utilize your diabetic shoes. They're designed usually with a larger toe box, stiff sole, Velcro instead of laces, and a softer insert to prevent any abrasions on the toes. And now that you're utilizing diabetic shoes, don't forget slippers in the house. Going barefoot's not an option when you're a diabetic, nor is wearing socks. Slippers work best when you use a rubber sole on the bottom, something that can prevent a puncture wound. You do not have to do this alone. Seek some professional help. Follow up on your routine exams. Follow up on your annual foot screens. We always include an ABI with our patients just to provide that extra level of care. Your feet are important and you want to use them for the rest of your life. So think ahead. Be responsible, remember your routine, and remember those simple steps. We'll get you through the rough times, and you'll take care of them the rest of the time.